report from 11 to 7. This is Edna Jones. She's a 75-year-old patient of Dr. Roberts. She was admitted on April 28th for bowel obstruction. She had a partial bowel resection completed on the 29th. She has a past history of hypertension, diabetes, and CHF. She didn't really sleep very well last night for us. She complains of nausea. We medicated her twice with Zofran. She has a clear liquid diet order but didn't take anything for us last night. She has an IV of D5.5 normal saline with 20 kcal infusing at 75 cc's per hour. Her output has been only one void early in the shift for us. She has an abdominal dressing, has a little bit of shadow drainage on it. Lungs are clear. I didn't really hear bowel sounds on her too well last night. I think she might be a little confused though because she was talking to her dead husband last night. She has orders to emulate the Hall CID with a system. She can have O2 at 2 liters per minute PRN. She gets physical therapy for ambulation. Straight cath PRN, connect to bedside drainage if more than 500 cc's obtained. Bladder scan shows 800 cc's, so she does need a Foley. Dressing changed daily with betadine.
Good morning, Mrs. Jones. My name's Lisa. I'm going to be your nurse today. How are you feeling this morning?
I'm having a little pain.
Where are you hurting at?
In my abdomen.
What does it feel like? Is it sharp, dull, aching, pressure?
Oh, it's a deep aching pain.
Okay. Can you rate it on that 1 to 10 scale, with 1 being no pain and 10 being a severe pain?
It's about a 7.
Okay. And how long has it been there?
About 2 hours.
Okay. Well, as soon as I get finished with your shift assessment, I'll see about getting you something for pain.
Thank you.
You're welcome. Do you know where you are this morning?
Am I at home?
No, you're at the hospital.
Oh, that's right.
Do you know what city you're in?
I think Parkersburg.
That's right. That's right. Do you know what year it is?
2008?
Yes. Do you know what month it is?
I think it's April.
It is. All right. And can you tell me your full name and birth date?
Edna Jones.
And your
4/1. I'm not sure the year, but I'm 75 years old.
Okay. Very good. Well, happy late birthday. You just had a birthday, didn't you?
Yes, I did.
Okay. What we're going to do this morning, Mrs. Jones, is do your shift assessment, your physical assessment, and we'll listen to your heart and lungs, check your eyes. We'll start up here at the top. Open your eye here. Good. Your pupils react quick to the light. That's good.
Good.
Any problems with your nose or your ears?
No.
No problems there with the oxygen on your ears?
No.
Can you open your mouth for me and let me look? That looks a little dry in there. Have you had any trouble chewing or swallowing?
No.
Okay. All right. Well, I'm going to listen to your heart here. You can just breathe normally. Very good. Now I'm going to listen to your lungs. If you can take big, deep breaths in and out through your mouth, I'll listen here from the front. In and out. Very good. In and out. Very good. Very good. Do you think you can sit up for me so I can listen to your lungs from the back?
I can try.
Okay. Very good. All right. Big, deep breaths in and out through your mouth. Very good. Look at your back side here. Skin looks pretty good. You've been getting up, moving around some?
A little.
Okay. All right, well, let's listen to your belly here. Looks a little rounded to me. How does it feel?
It really hurts.
Does it? Do you feel sick to your stomach any?
Yes, I do, especially when they go to fill it.
Okay. They gave you some medicine through the night last night. Did that help at all?
It took the edge off, but it didn't really help.
Okay. Now, do you feel any gas rolling around in your belly?
Not really.
Okay. Are you passing any gas yet?
No.
Okay. All right. Well, I'm going to listen here. Well, I've listened for a minute in each of these quadrants, and I don't really hear anything, so I'm going to poke around just a little bit. Is that tender?
That's very tender.
Okay. All over?
Oh yeah, it just makes me want to throw up.
Okay. All right. Have you drank anything?
Not during the night.
Okay.
Just the thought of it made me nauseous.
Just been too
Nauseous.
Okay. All right. Any problems with your private area?
No.
Any burning or hurting when you're urinating?
Some burning. It feels like I need to go, but I can't.
Okay. Well, let me feel your bladder here. Does that make you feel like you need to go to the bathroom?
Oh yes.
Okay. We're going to have to put a Foley catheter in you, I think. They did your bladder scan, and it showed that your bladder's full. So we'll have to put that catheter in here in just a little bit. Let me see your hand here. I'm going to check your pulses. They're good and strong. Pinch your skin just a little bit to see how your fluid is. That looks good. Check your capillary refill here. Make sure everything's circulating. Can you squeeze my hand for me?
Oh yes.
That's pretty good. Can you raise this arm up against me, pushing down?
Uh-huh.
Good. How about with this one?
Same.
Okay, good. How's your IV feel? Did it hurt or bother you any?
No, it feels fine.
Okay. So we've got D5.5 with 20 of KCl at 75 an hour. Left forearm, that site looks good. Let's check out your legs down here. See if there's any swelling. I don't really see any swelling. Do you have any pain or tenderness in your legs?
No.
Okay. We'll check your pulses here. Check these pulses. They're good and strong. Check to see how capillary refill is down here. All right. I'm going to bend your leg up here and pull your foot back. Does that cause you any pain in your leg?
They just feel very weak and tired.
Just weak and tired, okay. How about with this leg?
It feels weak and tired also.
Okay. But no pain?
No.
All right, very good. Now, have you been getting up, moving around some?
A little bit with help.
Okay. Physical therapy's working with you?
Yes.
Did they get you out of bed yesterday?
They did.
Okay. Did you walk in here or just sit in the chair?
I just sat in the chair. I was so nauseated.
Okay. All right. I'm going to just help you to roll over here real quick because I just want to take a look at your bottom, make sure it's not broken down any. Okay. That looks fine. Is there anything that I can get for you this morning? I know we're going to put the catheter in, and I will go get you something for pain. And I think I'm going to call the doctor and tell him about all the nausea that you've been having, you know, that's not being relieved with the medication, and see if we can't get something else for you.
Oh, that sounds wonderful.
Okay. You sit tight a minute. Let me give him a call.
Okay.
Hi, Dr. Robert. This is Lisa. I'm calling from 5 North at Camden Clark. I'm calling about Mrs. Jones in 503B. She came in, you know, you did the small bowel obstruction, she had with a small bowel obstruction, and she had the small bowel resection done on the 29th. She's had a significant amount of nausea. They've medicated her twice through the night with Zofran. And she's still complaining of nausea this morning, especially if you palpate over her abdomen. And when I do her assessment, I don't hear any bowel sounds at all. I didn't know whether you wanted to put the NG tube back down or to get an x-ray or what you wanted me to do with her from here. But I suspect things aren't moving in the downward direction. Okay, let me see. You want the NG tube back down to wall suction. Okay. And then get a 2-view abdomen x-ray.